Hello, this is the Newborn Nurse Podcast, and I'm your host, Rachel Ramsey, RN, BSN. This podcast is for expectant and new mothers and families, and we are here to share with you a list of incredible newborn resources, services, professionals, and tips and tricks. We hope the info on this podcast informs you, helps you, and most of all, eases any anxieties, gives you confidence, and empowers you to be the best parent possible. Knowledge really is power, and we are here to inform and guide you through this season with your new baby. I am your host, Rachel Ramsey. I am a registered nurse and certified postpartum doula. I have 17 years of professional neonatal and maternal nursing experience and 5 years as the owner of the Newborn Nurse, a Nashville-based service that provides in-home care and newborn education to new families. I hope this podcast helps each of you in some big or small way. Biggest of congratulations and thanks for listening. You've got this, Mama, and we are here for you. As a reminder, any information you hear on this podcast is not a substitute for professional medical advice or treatment. Please see the full disclaimer on our website for more details. Website is listed in show notes. Hey guys, this is Rachel back from the Newborn Nurse, and I have a special and amazing guest today, Dr. Shaun Samples. She's an OB-GYN here in Nashville, and I worked with her for, I guess I did the math today. It's been over 15 years ago that I've known you and worked with you at the hospital. Also, she's just getting off of call, so she's been up all night delivering babies. So I am so grateful you took the time to be with us today. So we'll just get started. I'd love to hear about your background, how you got started as an OB-GYN, and what made you want to become an OB-GYN.
I know. I actually went to medical school to be a pediatrician, interestingly. So my sister had a couple of things growing up, and we had just that magical pediatrician. Loved it. Was in the hospital a lot with my sister growing up. So I went to medical school. That was just like my passion. And I actually changed, like as I was entering my fourth year of medical school, like was writing my essay about why I want to be a pediatrician. I had all my recs, was in like a subspecialty like office, and I had done my OB-GYN rotation. So I went to like undergrad at Georgia, like at UGA, did my medical school at Mercer. So I was doing my rotation in Savannah, and I was on my OB rotation with high-risk doctors who were incredible. And just loved the rotation, but I'd never had like exposure to this field before, and love taking care of patients in all different areas. And that's the best thing about OB is like you get to see your patients in the office and different, like hopefully starting off as like maybe a teenager, and then like as they're like kind of growing up, and then maybe them wanting to start a family, and then into kind of the perimenopause, menopause. So it's like different sections of life. And I got to do a C-section. It was just one of those days, if anybody's worked on labor and delivery, and it was all hands on deck. And this doctor was like, do you want help? Because I like literally think there was like more than one C-section. He was like, and as a medical student, he was like, let's go, this high-risk doctor. And so I got to help. And I was like, this is the most incredible experience, like bringing life into the world. I love surgery. I thought that part was, and just the aspect of delivering vaginal delivery, C-section, seeing patients in the office, seeing them in the hospital, and just that continuity of care. So like, but this was like, as I'm writing, like why I want to be a pediatrician, I just kind of was like, I think this is what I want to do, but like, I'm going to have to, in like the next 48 hours, get new recs, write a new essay. And so I did it. And I was like, and then I was like, what if like, this isn't where I'm supposed to be? And then I was like, you know what, I'll start my residency. If I do this and then decide it's not for me, then I've lost 1 year, and I'll go back to being like maybe trying to be a pediatrician. So that, I mean, it literally was like in the like final hour. And then went to residency, and I was like, okay, this is the right choice. And another mentor had also said, which was a great thing, you have to also like the bread and butter. So there's like the excitement of probably like a delivery or the things, you're kind of rushing to do that you don't do as often, but like, those things that may be more mundane, like, that you may do like more often. You
Like
gotta
pap
like the bread.
smears.
Uh,
Like pap
yeah,
smears.
it's like taxpayers. And I can't think also, I was like, that was just a good thing, because like, there's aspects of being a pediatrician, but I was like, oh, that's true. Like, like what inspires me is probably not always doing some of the well baby checks and like, um, I don't,
But you
so
still
then
get
I
to see the babies and like have a little piece of
yeah, so you get to see the babies, a little piece of that. And so I haven't ever regretted my decision. It's been great. I really enjoy being able to follow a patient along for so many different parts of their life. And then hopefully they might send their mom, or I have patients I delivered and their mother came in town. And so they send their mom to me, their friends, and having these groups that I, know intimately, within my patient and other patients that connect too.
And I think we're getting to the age too, you may be seeing some people's daughters at this point,
Yes.
like their baby girls are coming in for now they're teenagers, and I have friends whose kids are going into college, which is so mind blowing. So that is such a cool point. I've never thought that you get to see kind of the whole aspect of their life. So let's say a mom is expecting and it's her first baby and she's, doing all her research. That's a lot of the moms we deal with are first timers. Can you talk about like what she should do to prepare on the front end, as far as like a team? So an OB-GYN, are there any parts of the pregnancy and after pregnancy that she should be looking into to kind of create her team and plan for baby?
Yeah, absolutely. So like picking like the provider, which in our practice, we have OB-GYNs, we also have midwives. So, picking a provider that they feel comfortable with. And then obviously there's support people that can be family, friends. We also work very well with doulas and always kind of, because people sometimes will ask, they're like, are you okay with like having a doula? I'm like, absolutely. Because I think anybody that helps like kind of bring your delivery or kind of the goals you want to light, I think we all work together really well. Because I'm like, I may be in and out of the room. The nurses on labor and delivery are awesome, but they may have one other patient. The doula can help you at home if you're contracting and like kind of that early stages of labor. They're also in that room, kind of also being your voice. They've talked to you about kind of your goals along with myself, and then can help you afterwards. And then also like, yes, like what you do, I'm like kind of talking about like, do you need somebody to help you like with breastfeeding, with nighttime care? Because I think attention also needs to be postpartum, because now we have all these classes geared up for this delivery, which is 12, 40 hours, and then they send you home with this baby. And it's kind of like, all right, here you
Well,
go.
yeah.
Yeah, because like I think you were just starting, my oldest is about to turn 10. And kind of now I love that in Nashville, we have so much to offer for support, for nighttime nurses and lactation and doulas, because it takes a team. You can't do it by yourself. Um, and I love that that is now something that we've had in the past 10 years, because I think it was just starting to probably become available when she was born, but not as much, I
Yeah.
mean,
Yeah, we
then
just
I,
turned 7 years old in a few weeks ago. And when I first started researching, there was not anything like this in Nashville that I knew of. Now, New York and LA, as I started to research, the big cities
yes,
had it. But like you said, I mean, it's in the last 10 years, it's grown and there's so much support, which is wonderful. Because I always say, if you look at the skyline of Nashville, like we're booming. There are babies there, as
yes,
you know, like
lots of
right,
babies.
there are so many babies and so many people that need the support. So I'm so glad we have a very diverse community of helpers in town now.
Hey everyone, this is Rachel from the Newborn Nurse. Thanks so much for listening. I hope you are learning some valuable and helpful information on this podcast. If you would like to learn even more, we have something new and exciting to tell you about. We have created our Newborn Care 101 online video course for first-time expectant parents or parents who want a refresher course in newborns. This course is taught by me, a neonatal newborn nurse and expert of 18 years and founder of the Newborn Nurse. It's so super important to make sure you are gathering your newborn information from a trusted and experienced source as you prepare for your baby. This course is a series of educational videos where you will learn everything you need to know about newborn care all in one spot without having to search and scroll all over the internet. You can take this course in the comfort of your own home and nursery with your own baby equipment and at your own pace. You can also rewatch the videos as many times as you would like with unlimited access to these videos for an entire year. Many of the families who have already taken this course have reached out to tell me how helpful it is to go back and be able to review these videos once their baby has arrived. In this course, you will learn swaddling, diapering, bathing, breastfeeding, bottle feeding, burping, cord care, how to use your breast pump and car seat, how to prevent mastitis, calm a fussy baby, and much, much more. You also get free printables, including a checklist of what to pack in your hospital bag, a must-haves product list for your baby registry, and the best part, you get free access to our Facebook online community group where you can meet other new moms and also have access to me, Rachel, for any newborn questions you have along your journey. The families who have taken this course already have raved about it and have felt it has been super helpful and allowed them to feel prepared, organized, ready, and knowledgeable about their newborn. For our podcast listeners, you can receive 10% off this course with coupon code, all caps, podcast, at the checkout. The link to purchase this course is in the show notes below. Thank you for being here and best wishes to you and your family. I hope you feel loved, supported, and empowered as a new parent. Thanks so much and have a great day.
So I want to talk a little bit about labor and more of the kind of medical part of all of this. Let's talk about an induction. I know a lot of moms, if they're going to have a vaginal delivery, they set an induction date. Like we have our moms who will let us know, hey, we're being induced May 31st or whatever. Can you talk a little bit about inductions, why a mom would be induced, and just kind of talk about that for a little bit?
I mean, a lot, and that's the thing we kind of will talk about in the early part of pregnancy is, kind of establishing goals. Like, do you want to go into spontaneous labor? Like you can go to 42 weeks, like we monitor between 41 and 42 to make sure it's safe. But there's also kind of like autonomy because I have some patients who want to be induced at 39 weeks if they're uncomfortable, and we just kind of talk about what that looks like. They don't want to go to 40 or 41 weeks. So there's the elective induction, kind of like I am, maybe uncomfortable, like I'm, not sleeping. I have a lot of just pelvic pain. I'm ready to be induced. There's medical reasons. So we're going past our due date. If fluid's low, if we develop hypertension. So the guidelines now have actually changed. Like when I was in residency, we deliver for preeclampsia, but if you had gestational hypertension, so that's where your blood pressure is elevated without signs of preeclampsia, we actually would still wait for spontaneous labor, or we got closer to 40, 41 weeks. But now newer studies are suggesting that we should induce at full term at 37. So that's a whole other, probably a whole other discussion. But I always like sit down and I try to sit with my patients and say, okay, here's the recommendations. We have hypertension at 37 weeks. I feel like it's, if we want to talk about induction, we can. If we want to go a little bit further to see if we have spontaneous labor, or maybe see if our cervix is more favorable for an induction, like let's do this safely. And we always just have that conversation because I want the patient to feel like she's part of the plan. Her husband, or her partner or anybody else is in there, to kind of say, okay, what does induction look like? And like, what do you want? So goal is, healthy mom, healthy baby. We're trying for vaginal delivery. And there's not a timeline because a lot of people, that's probably one of the most common questions I get is like, So like, if I've been laboring this long, are we going to go to C-section? If my water's broken
There's
this
a lot of
long,
numbers, people like give me the
yes.
exact answer. There isn't, sometimes there isn't an exact answer in labor.
Yeah, or they're kind of worried. Like, I think they're more so worried of, are we going to have to do a C-section just because I've hit this many hours of labor? And everybody, I try to say, everybody's labor looks different. And as long as we're healthy, we'll keep trying some things if you're comfortable with that. We have conversations along. I'll give you a great example of this weekend. It was a patient that kind of got stuck at like 8 to 9, and she was there for a while. And we, she was going on Medicaid, so we got an epidural. We talked about Pitocin. We did all the things, and we had the discussion of the C-section. But like I said, she looked great, baby looked great. And her nurse rocked the spinning baby. I mean, we did every position under the sun for about 3 hours, and all of a sudden it did. Baby just rotated, was right there, pushed, like had this like amazing, vaginal delivery.
I have
So
to
yeah.
stop and say, this is the reason I think everyone loves you so much. There are lots of OB-GYNs in Nashville, and there are many great ones, but you are one of the best. The patients, PATIENCE patients that you have for your patients, the fact that you're not quick to do a C-section. Some doctors are. You really listen to what their needs are, and you really care. And I remember sitting at the nurse's station at the hospital, and you would always be one of the doctors that kind of lingered. You would sit and talk to us, and you would look through your patient's chart, and you just took that extra time to wait at 8 centimeters for a little bit and see if the baby would come vaginally. That's just how you roll. And I think that says a lot about you and why you're so loved, is that you care about each individual mom and their situation, and really, really give them a chance, so I commend you for that.
Well, wait,
Yeah.
I know, 'cause you want them to be, and some people, unfortunately, who, let's say, we do all the things and we can't get it past 8 centimeters, like, as long as the baby and the mom looks here, and then she kind of comes to that decision and she feels like we didn't rush into the decision. And afterwards, that's also very redeeming. If she did get a C-section, that wasn't my goal, her goal. But afterwards, she's like, you know what? I feel like we really gave it like 200%. And it's not ideally what I wanted going in it, but I understand that's what needed to happen. Like, having them feel okay with that decision, makes me feel like, yeah, we did our job. Like,
Yeah. You exhausted
that,
all avenues before
we
making
exhausted all avenues, because sometimes that does happen. And I know I kind of didn't answer as much what induction looks like, because I tried to kind of give some realistic expectations. So there's a first time mom, like, it depends on if her cervix is dilated. Um, but we talk about beforehand, okay, what is it going to look like? Like, if we're not dilated, it's going to take some time. Um, you know, Somebody yesterday had like, a 13-hour induction, but it can easily take 36, 40 hours if we're starting off at like close. We have medications that try to get your body ready for Pitocin. So we have Cytotec, something called folate bulbs. And we kind of talk about what that looks like, why we choose different things, so that I feel like we do a good job, like myself and our practice, the nurses at the hospital, of educating patients of like, what it's going to look like, how long is it going to take, why are we using the medications, a lot of education behind like Pitocin. Like, we are not going to do anything that's unsafe for the baby. We have protocols to make sure we go up every so often. We're looking at the heart rate, contraction pattern, and that all factors into like what the induction looks like. Because that's probably a question or concern for patients too, is like with Pitocin, like making sure that we're doing it safely. So,
I was also going to ask, so when you and I first worked together years ago, it was like pre-internet, like pre-social media, which is crazy. I remember learning about Instagram from a nurse on our floor many years ago. But anyway, nowadays with social media and influencers, and it's blown up. A lot of our moms that I know of are always looking at ideas for labor. They're looking for classes, they're looking at tips. Of course, they look into doulas. Is there anything specific to like vaginal delivery labor that you could point to? Like, are there any certain classes you highly recommend or anything like that where a person could go online and look for specific information just pertaining to labor that you know?
I mean, most of our patients choose the ones that are at the hospitals or like the doulas in our community as
Okay.
well. You know, for resources. And I have patients that do just like, you know, a lot of education, just kind of probably on their own too, of different birth experiences. You know, probably watching some videos, like what does it look like to go into labor, especially if you're going unmedicated. It's like having the tools to kind of effectively, you know, manage pain control, different positions, setting the tone of the room. So probably that, yeah, as far as preparing for labor. And we talk about it too in the office of like, you know, what to look for, like when to give us a call, when to come in, just being accessible in our office if they want to come in early versus, you know, if we really think they need to go to the hospital, like if, you know, if their water broken, they're contracting, they're, you know, really uncomfortable, we'll evaluate them there versus in the office.
Okay.
But those are kind of the big things is like classes at the hospital really and kind of our doula community as far as like labor preparation.
Okay. I almost forgot. So you guys do have labor classes at the hospital?
Yes, we
Okay,
do.
cool. That's good to know.
Yeah.
So that was a vaginal delivery. Let's talk a little bit about C-section care. Do you have any specific tips for postpartum C-section care once a mom gets home from the hospital?
I've actually been reading a little bit more on this recently because I think a lot of times people are like, all right, I want to kind of get back into is actually just taking the time to take care of yourself. So like good sources of nutrition. And so like we had a big surgery. We always talk about we need good building blocks to heal well. So good sources of protein, you know, fats, that's going to really help with our healing. And I think walks are great for getting outside because you're just kind of moving around. You're not quite as, you know, stiff. And being able to do a little bit more. And I think knowing that, yes, we'll see you at your 6-week postpartum visit, and it's like, okay, you can kind of resume normal activity, but really still being a little bit more intentional, slow with movements is actually going to help the healing process versus being like, all right, I was cleared and I did this, which is not, but I was like, all right, I'm a runner. I'm going to run. I mean, I remember running at 6 weeks, but really you need to just listen to your body, take it slow, ease back in. Also, we have a great community of pelvic floor therapists, which I think a lot of times people think about if they had a vaginal delivery and we have a tear and rehabbing the pelvic floor. I don't think people think about it necessarily as much for a C-section, but they can help. I mean, just the pressure of the pregnancy, you know, helps, you know, reestablish the pelvic floor, but helping heal the C-section, the therapists do a great job at that too. You're just kind of like trying to like work on your core exercises, how the incision, because a lot of questions we get asked is like the shelf after a C-section. So physical therapists really can help with that. There's massages you can do. Some of them can cup, you know, the incision just to kind of help that area not form that shelf. It's a common question we get is actually just taking time.
Yes. And a lot of our moms, as you know, are high achievers. They are driven. They are running at 6 weeks. Postpartum.
No, I'll do what I did.
Yeah, so it's definitely a learned thing that they have to learn to like slow down a little bit during the postpartum. And then, like you mentioned, I'm so excited to see pelvic floor therapy as a new resource. Also, it's kind of a new buzzy thing around town.
Yes.
And for so many years, I think women just didn't talk about it. They had incontinence or whatever going on, and they just didn't really talk about it. So I'm glad that that's a resource these moms can use to help postpartum for sure. A lot of our moms travel for either vacation or work. We have a lot of country music singers, whatnot. What are your thoughts on traveling while pregnant? When to stop traveling? When can you start traveling again? Anything revolving around, like, I guess, plane travel in particular?
I know, and there's not set guidelines. So, I mean, kind of what I probably say might be a little bit different because I typically say you want to be in the general area and that kind of that last, month. Um, I had a patient who was probably right at that 34 to 35 weeks, where I say between 35 and 36 weeks, you want to be within like an hour and a half. And unfortunately, she went to labor at the beach at like that 34 to 35 weeks. So anything can happen at any time of your pregnancy. So I just kind of say, if you're going to be somewhere, just always kind of know, like, is there a hospital nearby? Like, but I usually say about that 35 to 36 weeks to be in the general area, like in the United States, like internationally, because I have some patients who are like, oh, can I go, here? Like, can I go to Italy at 30 weeks? I'd say usually third trimester you want to be,
Yeah.
like, not
Unless you want a European baby. I mean, hey.
exactly. And then just making sure we talk about like wearing compression hose, making sure you move around because you're more increased risk of blood clots in your legs in pregnancy. So it's making sure every couple hours you just get up, walk around, go to the bathroom. Compression hose help with like swelling, which is very common in a pregnancy and when you're traveling. And then traveling after, that then, that does take in consideration now you have a baby, because I do know that some pediatricians don't want the babies to travel until kind of they start the vaccinations. Some are okay depending on season, if it's in the summer versus, I know that's kind of postpartum can differ. Depends like if you're driving, if you're flying, kind of if it's flu season, and pediatrician dependent on if you've gotten your vaccines or not.
You got another person to take into consideration at that point.
Correct.
Little
Yes.
person. That's awesome information. I had forgotten about the compression hose, because if you're sitting for a long
Yeah.
period, you definitely need those. I'd like to swing and talk a little bit about postpartum care. So with postpartum moms that you see in office, what have you seen for the moms who seem to do well and thrive, and thrive is the best word I can think of. What kinds of support does that mom have postpartum? And can we talk a little bit about postpartum anxiety and depression and anything you would like to mention there?
Yeah, I think, big thing is mental health, which is also in Nashville. We have a great resource of therapists. I know National Collaborative, Readiness, and Monks, those are two big groups. Because I talk about it in the hospital before they even go home. I know they have their, depression score that we give them, but I kind of make sure that family members, when I'm talking about mental health, are all in the room listening. I kind of like, hey, everybody's a part of this. Because I want anybody in the family to be able to call me and say, I mean, I can't maybe talk to them in detail, but just like, hey, I'm worried about my wife, or I'm worried about, my sister, my daughter. So we talk about the baby blues. So it is very normal. There's a fluctuation of hormones in the first couple of weeks. So I always just say like, hey, anticipate. There may be a lot of emotions that just come out of nowhere. Happy tears, sad tears, frustration, just crying at a commercial. This is very normal. In like 2 to 3 weeks, that cloud should start to lift. And then if it's not starting to lift, let's think about postpartum depression, postpartum anxiety, and that's a big one. I think a lot of people we've talked about for years is like, we're not connecting with my baby. I'm feeling really sad. Postpartum anxiety can be a little bit sneaky at times, where it's like, well, of course it's normal to worry because I'm a first-time mom. But it's when that worry starts to take over of not maybe letting somebody help you, where you're not being able to kind of go outside. And so I talk about it in the hospital. We talk about their postpartum visit. Pediatricians will screen them when they usually see them about 2 weeks. They'll reach out to us if they're worried. If there's somebody else who thinks that's high risk for postpartum depression, anxiety, we make sure we check in with them, even if they're not scheduled for their 6 weeks. Like we have a phone call system we can put in like as an order to like remind us to call a patient just to say, hey, we're just checking on you. So we talk, sometimes it comes in as more kind of just like anger. Like I have some patients who will say, I just feel kind of snappy, and they don't think of that as more, I just kind of talk about it as mood disorders, you know, anxiety, depression, more anger and frustration. We just say these are mood disorders that our hormones can have some fluctuations, and talk about it that way. And kind of also just normalizing that this happens. It has like, it is not completely something that is completely up to you. Like a lot of people are embarrassed to talk about it. They're like, well, am I not being a good mom? Am I not doing this? I really want that open communication to like, for them to ask for help. From myself, from friends, I had a patient last week who was like, I have all these people around me, but I just feel like I can't ask for help. Like I should be able to do this. And we can't do this by ourselves. You know, we're not meant to do that. That's why you talk about tribes. It's like we're meant to have people surrounding us to help. And I just want them to know to ask your friend, like if somebody's offering to help, they truly want to. Like it's not a sign of weakness to be like, hey, I'm struggling with this. I need you to help me with this. So we talk about that a lot of just it's not a weakness to ask for help or to need something. You're
It's actually a
exhausted.
strength. It's a strength to be.
Yeah, absolutely.
Yeah.
When you just had a baby, you're, sleep deprived, all these things, and you're trying to figure out how to take care of this, new baby. And it's a lot. So,
I know that a lot of our clients, X this out. They just talking about pelvic floor health and the community we have here in Nashville. Again, with mental health, we now have an amazing community of support here in town. So help is available. That's another thing. Like if a mom is struggling, I want them to know like there is a lot of support and there's a lot of help and there are a lot of things you can do, from medication to counseling to support groups. We even have a lot of our clients who have gone to counseling as a couple, because having a baby is a game changer for your family. I mean, it's a
oh,
different dynamic, and sometimes the men are like, what's going on, so it's helpful, I think, sometimes for both parents to go to counseling and kind of figure out that new dynamic together. But all that to say, help is available. I think moms sometimes don't know that there's a whole world of mental health help available here in Nashville, and wherever you are in the world listening, you can Google for your area. And there also are a lot of online options as well, which is really nice.
which is what's great. I always tell them, like, you have to find what's best. Cause like, I think sometimes trying to get to maybe appointment, but that's like our counselors here. I mean, it could be one-on-one, it can be with your partner, because a lot of times it's just learning new communication. Like I need, like I need help with this, or if I'm saying that, like this is what I'm trying to communicate. And then you can do telehealth, which is great because sometimes just like getting there. So if you're taking that driving, getting your newborn in a car seat, diaper bag ready, if you can do telehealth, that's half the battle. Sometimes you need a group because you want to hear that what you're going through, somebody else is going through, that you're not alone in this. So
Right.
some patients really benefit to say, oh, I'm not the only one feeling this way, if they're in a room with moms at that same stage. So that's also helpful.
I think there's power in that, like whatever you're dealing with, to know someone else is also dealing with that. It's very helpful to be able to connect and feel like you're not alone in that situation. Okay, so what about, I would love to ask for your last question. What is your most memorable delivery or great memories of being an OB-GYN for how many years is it now? Pushing 20?
I know, I think 14,
14.
15,
Okay.
14 in private practice, maybe.
Okay.
So
Wow.
I've been in the same group, which, great physicians. We have lovely nurse practitioners, midwives, or nurses. I mean, just we're very fortunate to have such an awesome staff.
You do have an amazing group. And it's
Uh,
really the prettiest office in Nashville also. Whoever did your design is awesome.
yes, that too. You're like, oh, I'm gonna go look
Like you're in a
like
hotel lobby
there.
when you
I
walk
know.
into your office.
Ah, gosh, that is really, oh, That is really, really hard. Most minimal delivery. I mean, I don't know. It's hard to pick just one, but there's definitely, you don't want to single something out. I mean, there's so many special moments. There are patients that you have been with who struggle for infertility, and just to finally put a baby on their chest, with the years of struggle, or um yeah, the dads like trying to cut the cord, and which is always just, a great experience. Um I don't know. It's hard. Surprise genders. I mean, there's just so many there. It's really hard. Like, everybody gets so excited when you're like delivering a baby, and it's like, everybody in the room is like, is it a boy? It's a girl. So I don't know.
That is fun.
It's hard to narrow it down to one experience. I know there's actually a patient. Well, okay, yeah. That one will definitely that would be a hit, but I have one too, but definitely everybody be able to figure out. There was definitely a patient in the community whose sister was a surrogate, so that was a really incredible delivery.
That is
So
awesome. Got chills just now, just talking
yeah.
about that's awesome. Well, so fun. Thank you for your time today. Again, like I said at the beginning, you've been up all night delivering babies. So thank you for you don't look
No,
like
it's
you
great.
look great and beautiful. So thank you for taking the time to chat today. I know a lot of moms are going to be very excited to hear this and hear your information because you are much loved in the community. So
Well, thank you very much for having me, and yeah, always reach out.
okay. Thanks, Dr. Samples.
If you loved what you heard on our podcast today, don't forget you can learn even more with our new Newborn Care 101 online video course. This course is taught by me, a newborn registered nurse expert, and covers all kinds of newborn education, including swaddling, diapering, bathing, breastfeeding, how to use your breast pump and car seat, sleep training, and much, much more. You also get free access to our online course community, which gives you direct access to me, Rachel, for any newborn questions along the way. Our podcast listeners get a special discount, so make sure to use coupon code PODCAST in all caps at the checkout. The link to purchase this course is in show notes below. Thanks so much and have a great day. Although I am a nurse, I am not your medical provider, and any information from me is purely educational and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a professional for your particular situation before making any decisions. My opinion about any brands we mention on the podcast is based on my personal experience and is not an endorsement about the suitability of any products for your particular need.